So we want to think about 5 of these. Oh, hey there, this is Dr. Evan Osar. Welcome to this edition of Integrative Movement Insider. Do you work with older clients that have low back pain? Well, if you work with older clients, likely you're working with lots of clients that present to you with common issues or common presentations of low back pain. So in this edition of Integrative Movement Insider, thanks for being part of our community, by the way, and thanks for attending or tuning into this Facebook Live edition. I want to discuss 3 aspects of, or related to, low back pain, briefly discuss 3 different types of causes for low back pain, and then really just to give you some strategies and thought process around low back pain and your exercise choices as a health and fitness professional. Because if you listen to and attend to and pay attention to what's going on in the industry, you'll hear lots of people discussing that posture doesn't matter. There's no evidence of posture mattering or making a difference. And if you look at people with low back pain, some people have disc herniations, some people don't. So it doesn't really matter at all the position people exercise in or what they do with their low back or their hips or their pelvis. So the first thing I want you to take home from this, so the 3 keys, the first of the 3 keys is there are no absolutes. So let me write this down. 3 keys. So hopefully this is showing up straight, but it may be backwards. Yeah, it's probably backwards for you guys. So first key is number 1, no absolutes. We can't make absolutes when we're thinking about our client population. Every client comes to you as an individual. They have an individual body makeup. They have an individualized history. They have individualized goals. And just because 2 people are the same age, they have the same background, relative background, they don't have the same body makeup, they don't have the same motor control strategy, they don't have the same medical history. We have to take all those things into consideration when we're discussing low back pain. So before we go on, there's actually 3 types of low back pain. So here's the second key, is you have to understand what type of, or what's potentially causing your client's low back pain. So let me talk briefly about the 3 types of low back pain because you're going to treat each one relatively different. Number 1, first type, is what's referred to as nociceptive. Nociceptive means, or noci, the word noci, N-O-C-I, refers to pain, the interpretation of pain. Ception is the interpretation of it, or your body's awareness of it and its interpretation of it. Noci is actually pain, refers to pain. So nociceptive pain is the typical kind of low back pain that we may experience from like disc herniation. So say, for example, I know you have those clients, maybe you've experienced this, where you bend forward and all of a sudden you're just like, oh, you feel something in your back and you're like, I can't stand up. That's an example of a nociceptive pain. It's not in your head, something, you herniated the disc right then, you just had an acute flare-up of a disc herniation or disc bulge, and yeah, it's causing a physical pain. Shoulder tendonitis, hip, impingement. Those are actually nociceptive types of pain. The typical wear and tear, the common musculoskeletal type of situations we experience and our clients experience. So a lot of pain, low back pain, is associated with that type. The second type of low back pain is neurogenic. Neuro meaning nervous system, genic means genesis. Low back pain from a nervous system standpoint. So now let's go back to that individual that bent over and they now have pain shooting down their leg. So they can have nociceptive pain, they have a disc injury. They can even have neurogenic pain shooting down the leg and impacting either from a pain standpoint and or a muscle function or sensation function. They may lose sensation. For example, I'm sitting at my desk a lot now working on the 2nd edition, trying to get it done I'm going to get it done by the end of the month here. So spending a lot of time in front of the computer, not always in the best posture, and I'm not saying there's a best posture just for sitting. However, you do have to get out of your chair a lot, and the posture does matter. Because what I find is, if I'm not paying attention to my posture, and I stay in a slump position for a long period of time, like intense periods of writing, well then I start getting some numbness in my big toe. Again, it's not in my head, it's just like, that's a neurogenic, the second type, I didn't write it down, neurogenic type of low back pain, or pain. Okay, so you got your nociceptive, which is your typical musculoskeletal type of origin of your low back pain. You have your neurogenic, more nerve-related, spinal nerve-related type of issues. Spinal stenosis would be another example of that as well. The third type, and this is the important type, and this is where people tend to, when they say it's all in your brain, this is the type of pain that they're referring to. The third type of pain, general pain, is nociplastic. Again, noci referring to pain. Plastic means you're starting to change the brain and the nervous system's interpretation of pain. An example of nociplastic type of low back pain are the clients that have maybe been diagnosed with chronic fatigue or fibromyalgia. There are no tests that you can show or demonstrate or conclusively say that this person has this issue, but they're super tender to the touch. You do a little bit of exercise with that person, and the next day or later that day, they're like, "Oh my God, I'm in so much pain. I don't know what you did." And you're like, "I did some breathing exercise. I did a little bit of foam rolling. I did a little bit of, we did a little bit of mobility work. Nothing strenuous or intense, but their low back symptoms flare up." So a way of thinking about this is the input doesn't match their expression of the pain, meaning like what you did doesn't match what their expression or interpretation of that pain is. Now, different, or say contrasting that, is that you worked out in your garden. It's getting to be spring here. Well, here in Wisconsin, it's like still snowing, but it's okay. We're getting to spring. Days are getting longer. It's getting relatively warmer when it's not snowing. However, people are outside doing more in your garden, digging, things like that, picking up dirt. Yeah, if you're out there all day in your garden, well, yeah, you can have some low back pain associated with increased activity, doing, lifting, twisting, bending, doing things that you're not used to doing. That's different. It's when you're doing something and you're like, yeah, I was just cleaning out my cat's litter box yesterday, and now I can barely stand up, and symptoms are like that. Or, like, they can do an intense workout one day, be fine, and then they wake up the next day, they're like, went for, half a mile walk, and now I can barely move. It's just a 10 out of 10 pain. So it's a hypersensitization of the nervous system. It's an expression and their interpretation of their pain, because that's really what it is. It's not actual pain or physical cause of pain, whereas the first two types that I discussed, they're physical causes of pain. This is more of a nervous system mediated cause of pain. So you have three types of pain. So you have to understand which type of pain your client is dealing with. Easy way to think about it is if your client has chronic pain, they're in the nociplastic, that last category. If they have pain associated, low back pain associated with a specific position, sitting too long or bending over, and it's hard for them to get back up. If they're your older clients and they say, "Oh, I feel better when I'm leaning over on the shopping cart like that. It gives me relief and I can walk further," that's more of a mechanical type of issue associated with spinal stenosis. Those are more issues that you and I can do a lot about. Now, that third category, that nociplastic category, people with chronic low back pain, because everybody that has chronic pain is moving into that nociplastic. You're changing things at the nervous system. You're creating changes at the nervous system level. We can still do a lot. However, that last category, we have to do more education. We have to educate our clients that just because they feel more discomfort after a workout, for example, it's not necessarily due to tissue trauma to soft tissue or a disc or impingement upon a nerve that you may feel with nociceptive pain and or neurogenic origins of pain. So that's why this education is so important, and communicating with your client is so important, and why you can't just say, "Hey, you know what? Everything's in your head. Let's just go train." Because if you have a client with a disc problem and you're just continually moving them through flexion-based exercises, and flexion-based exercises or movement is what's causing their issue and exacerbating their nociceptive pain or their neurogenic pain, well, then you're actually being part of the problem versus part of the solution. However, if you have a client then, or a different client that's coming in and they're like, "Yeah, I just had this discomfort all the time. It never goes away," then the education has to be around, "Hey, you know what? You may feel a little bit more discomfort after this. As long as we're doing things that are safe, you're using your assessments, you're using your strategic process, a guided and evidence-based protocol or process with them, then you're doing things that are good for them." Let me give you a quick example, and then we'll get out of here. So, I forgot to talk about this stuff, but we'll talk about this stuff next time. I'll actually talk about this next time. So, one of my friend, you guys know that I do a lot of consulting and visiting with Jackie Bachmeyer down at Evolution Fitness and Wellness. One of our clients I assessed multiple times. Jake, awesome dude, 78 years of age, really, really sweet guy, comes to her facility, trains with the coaches minimally twice a week, every single week. Doesn't do a lot on his own. One time last year when I was down there, I gave him some exercises specific. I'm like, Jay, let me look at you. Just give him a complimentary session and just give him some things to work on. So I saw him this year again, and I'm like, he's like, yeah, I didn't do your exercises, and pain is the same. And I said to him, I'm like, Jay, what I want you to do is just for 7 days. 7 days. And I texted him twice a day, every day, to make sure he did 3 simple exercises. Number 1 was breathing. Number 2 was working on, I should say, breathing and also working on his posture. Number 3 was working on motor control in a couple different patterns. So breathing and then 2 additional patterns. Again, it took him like 5 to 10 minutes max. And I said, do this twice a day. And I texted him just to give him encouragement. Came back the next day, or 7 days later. He's like, you know what? I was really feeling better, and then I just had an exacerbation, so I'm a little discouraged. I'm like, you know what? Those things happen. I said, continue with it. Well, I sort of forgot about it a little bit, and I stopped giving him those weekly cues, or sorry, daily. Stopped texting him daily. Well, he just emailed me, Jackie, and Jason, Jackie's husband, and he said, hey, I just want to let you know I've been continuing the exercises you gave me last time, and you know what? I'm finding it easier to get off the floor. I'm finding it easier just to move around. And even though we were looking at his balance as well, my balance is changing a little bit, but not dramatically. I'm really encouraged by this process. And that's the biggest thing I want you to take home from this. And that's really your third key, is focus on your process, your client's process, and not the outcomes of the process. Too many times we want to help our clients lose weight, gain strength, gain mobility, go on that trip. That's awesome. Those are their goals. That's very important. It's very important that we're working towards them. What's even more important is the process that we're taking them through. And what was really cool about that email, and I was so thankful to be part of this process for Jay. He really said, just thank you. He's like, thank you for allowing me to see the benefit. And now he's on this, this is his habit now. So now that's really why you want to celebrate the process that your clients are on. Don't just celebrate when they get to their goals, because if they struggle or they fall off, it's going to be a while before they get there. So celebrate them sticking to the process. And that's what I did with Jay early on. I'm like, hey, Jay, keep going. That's awesome. Just keep going with it. Keep doing your exercises. Maybe you don't feel different. Maybe you do. Just keep going. Maybe you had a little setback. Just keep going. We all have things that come up in our lives, stress, things that come up. We slept wrong, we bent wrong, whatever it may be. Just keep with the process, because anything that we've been successful with, it's always about sticking with the habits, sticking with the process that ultimately gets us there. So I hope that helped you. I hope it made sense about low back pain, the different types of low back pain, causes of why your clients may experience low back pain. And it's our responsibility to do our due diligence. Take your client's history, understand where they're coming from, what they've had done, what has worked, what hasn't worked, their medical indications, contraindications. Take your case history, your appropriate medical history with them, know what they can and can't do, know the things that you really want to work on, do your assessments, and then put them on a process, your systematic process, or you can borrow our systematic process. That's why we share it so frequently here on our YouTube, our Facebook, as well as our Instagram page at IIHFE, is because we want you to have a successful process, a process that we use with our own clients and patients and shown success for the last easily 20 years. But again, it's an evolving process. So keep doing what you're doing. Most of you that are part of our community, you're already doing this. So I just want to help support you in that, help give you some education around why clients have low back pain so that you can be educated and can in turn educate your clients. Because a lot of your clients, medical doctors, they don't have the time and they don't even have the knowledge about this information that I'm sharing with you. So then it's up to you and I to give them that information. So again, thank you for all you do for your clients. If there's anything we can do to help support you in educating your clients or giving you information, resources for your clients, please reach out, let us know. This is Dr. Evan Osar with Integrative Movement Insider, Integrative Movement Institute. Thanks so much for allowing us to be part of your community and all you do for your clients, for being that leader that brings people together, that educates, empowers, and helps enroll other people, because I truly believe that you and I, as health and fitness professionals, we can be transformative in this world. Make it a great day. If I can do anything for you, leave a comment below. If you have any questions, leave a comment below, and I'll get back to you. Take care. Have a great day.